SBO is the best.
Let's lock in. So in this topic, you're learning how sports is affected by ethics and society. Basically, we're going to look at what's right versus what's wrong in sports and how fans and performers behave. So after this video, you'll be able to define the key terms accurately, apply them to sporting examples, and for longer exam questions, be able to evaluate the positives and negatives. We're going to cover these three big areas in this video. We're going to talk about conduct of performers. We're going to talk about performance enhancing drugs and prohibited methods. And we are going to talk about spectator behavior and hooliganism. Okay, let's start with conduct of performers. This is all about how performers behave in sport and whether their behavior is ethical. The key terms you need to know: etiquette, which means good manners and appropriate behavior in sports; sportsmanship, which has to do with fair play, playing by the rules, playing with respect and honesty; gamesmanship, which means pushing the rules to the limit to gain an advantage without actually breaking them; and contract to complete. Contract to complete is sort of an unwritten agreement that performers will compete fairly and within the rules, showing respect to opponents and officials. So let's give some examples of each of these key terms under conduct of performance. So etiquette, it's sort of the unwritten do the right thing behavior, right? So examples are like shaking hands before or after a match, congratulating the opponents, respecting the referee's decisions, helping an injured opponent. So it's all about respect. Sportsmanship as well is about respect, integrity, honesty. Examples of sportsmanship could be following the rules when nobody is watching, accepting decisions, not trying to cheat, and showing respect to your opponents and the officials. For example, in football, a footballer might kick the ball out of the game when someone is injured, even if they had the advantage. Gamesmanship is sort of the gray area where the behavior might be legal, but it's not always ethical. Examples are time wasting in football, like taking ages to throw in or to take a corner during the last minutes of a game. Another example is sledging in cricket to distract the batter. Another example is slowing down the play to disrupt the rhythm. Another example could be committing strategic fouls that break the flow of the game but are still accepted in sports. So the key difference is that gamesmanship is about gaining an advantage, often at the cost of fairness. And contract to complete links directly to etiquette and sportsmanship. So this is where you agree to make the contest fair, you agree to respect safety and the rules of the game, you accept that sports should be decided by skill, fitness and tactics and not by cheating. Now let's talk about PEDs, or performance enhancing drugs, and prohibited substances and methods. We are going to talk about the categories of prohibited substances. We're going to look at their basic positive effects, which is why performers might take them, and the negative side effects, which are the risks. And we're also going to be able to match which types of performers in which types of sports would take different types of substances. It's important when talking about PEDs to be clinical and factual. You don't just want to be ranting and just waffling. Just explain what you're talking about and leave it there. Stimulants. Let's start with stimulants. So stimulants are taken to increase alertness and to reduce fatigue in the short term. The examples of stimulants, the most common one is caffeine. Some positive effects of stimulants: it increases alertness and reaction speed. The performer feels more energetic. It can delay tiredness. Negative effects of stimulants: increases heart rate and blood pressure, can lead to anxiety, insomnia, and shakes, and it has a risk of heart problems. Examples of sports where stimulants would be used would be in sprinting. So sprinters would probably take stimulants to have faster reaction time, and also in team sports where sharp decision making matters, like in basketball or in football. Now let's look at narcotic analgesics. Narcotic analgesics are simply very strong painkillers. Why performers may take them? So the positive effects are that it reduces pain so the performer can keep going, and it can mask any injury pain temporarily. So you could be injured but still be able to train and perform if you take narcotic analgesics. Negative side effects, it comes with a risk of addiction, can lead to slower reactions and drowsiness, and it can worsen your injury if you are hiding the pain instead of actually treating the injury or resting. Next, let's talk about anabolic agents. So anabolic agents like anabolic steroids lead to an increased muscle mass and muscular strength. Some positive effects of anabolic agents are increased muscle growth, improved strength and power, and faster recovery between training sessions. The downsides of anabolic agents is that it comes with serious risks to your organs and your hormones. It comes with mood swings, mood changes, and it can lead to long-term damage and getting banned from your sports. Anabolic agents are usually used in sports where strength and power are important, like in sprinting, in weightlifting, and things like that. Next, we have peptide hormones like EPO. EPO is a peptide that stands for erythropoietin, and EPO increases oxygen carrying capacity by increasing the amount of red blood cells that you have in your body. So the basic positive effects, it leads to improved endurance, it increases oxygen delivery to muscles, and it can delay fatigue in aerobic activities. Negative side effects, it can cause your blood to be thicker, which increases the strain on the heart. It comes with a higher risk of blood clots and leads to serious long-term health risks. Examples of sports could be anything endurance based like cycling, running, triathlons, marathons, and all of that. Next, we have diuretics. Diuretics basically cause you to pee. They cause you to pee more. So they cause an increased urination, which is used to lose weight quickly, and they can also be used sometimes to hide other substances. Basic positive effects of diuretics: rapid weight loss, obviously, and it can help certain people to meet their weight group in sports like wrestling or boxing or horse riding or judo and things like that. Some negative side effects of diuretics: dehydration, can lead to cramps, dizziness, and reduced performance, while also increasing the risks of developing health issues. Next, let's talk about blood doping. So blood doping is the prohibited method that you need to know for this AQA course. And the high level explanation that you need to know for blood doping for your exam is that blood doping aims to increase red blood cell count to be able to improve oxygen transport and improve endurance performance. And some reasons why it might benefit performance is obviously because it increases oxygen carrying capacity, and this would benefit a performer in any endurance sport like cycling or long distance running. However, some side effects you must know for blood doping is that it leads to the thickening of the blood. In other words, it makes blood more viscous, Viscous or viscosity just means thickness. It can lead to potential infection because the way blood doping is carried out is basically a type of blood transfusion. It can also increase the potential for a heart attack and lead to an embolism, which is where a blood vessel gets blocked. So don't overcomplicate it when you are talking about blood doping. Just talk about it leads to more red blood cells, which leads to more oxygen delivery, which leads to a greater endurance. But list out and talk about and explain the health risks as well to evaluate. Now let's talk about beta blockers. This is a type of substance that is subject to certain restrictions, and they can be restricted in certain sports, but not all sports, which is why we're talking about it in the context of restrictions in certain contexts. So beta blockers, why are they taken? To reduce heart rate, to reduce muscle tension, and to reduce blood pressure. They also help to reduce the effects of adrenaline and improve fine muscle control or precision. Side effects of beta blockers can lead to nausea, weakness, and heart problems. So the whole thing of beta blockers, they basically help you to be calm. However, when you're talking about them in exam answers, you can mention that beta blockers should only be prescribed by a medical professional. And in sports where they may be restricted, they shouldn't be used because they give an unfair advantage, especially in precision sports like archery, shooting, snooker, golf, and things like that. Alright, now to show the examiner that you really know your stuff, you should be able to match performance enhancing drugs to the types of performance, the type of sports that it would be most useful to based on their main function. So for stimulants, you want to talk about any sport that requires alertness. So it could be sprinting, it could be any team sports that need fast reactions like we spoke about before. For narcotic analgesics, you want to talk about pain relief. So pain relief would be important in contact sports like MMA and so, where people get injured a lot, in heavy training and things like that. For anabolic agents, you want to talk about muscle mass. So sports like weightlifting, sprint, and throws, those are the areas where they would most likely be used. For diuretics, you want to talk about weight loss. So mainly combat sports with weight categories. It would also be beneficial for a jockey. For peptide hormones, you want to talk about oxygen carrying capacity, so endurance sports. For blood doping, again, you want to talk about oxygen carrying capacity, endurance sports. And finally, for beta blockers, you want to talk about fine motor control, so any precision sports like we talked about. Now let's talk about the advantages and disadvantages of taking performance enhancing drugs. Let's start with the pros and cons for a performer. So the advantages why a performer might do it is that it comes with an increased chance of success. It can lead to fame, wealth. Some performers claim that it levels the playing field because maybe other performers are already using it, and so they're just using it to be able to have a fair advantage. But it's still illegal and unethical in sports. Now, the disadvantages why it's a horrible, terrible decision is that it's cheating, so it's immoral, and it comes with a whole ton of health risks. It can lead to fines and bans and reputational damage. So even though there might be some short-term benefits, it's always important to mention and explain the long-term costs being much more bigger. Now let's talk about the disadvantages to the sport or to the event when performers take PEDs. So this is more bigger picture. One, we have reputation, damaged reputation because the sport looks corrupt and unfair. And two, we have damaged credibility. So fans stop trusting the sport, stops trusting results, and any records or awards or anything starts to feel meaningless because fans start to feel like all the athletes were just made in a lab, and so the sport might lose integrity. Now let's talk about sporting behaviors, spectator behavior specifically. We're going to look at the positives and negatives. So the positive influence of spectators: one, they create a great atmosphere because the crowd energy can lift the performers and make events exciting. Two, we have home field advantage. Home teams or home performers a lot of times may perform better when they are playing at home because of the support they get and the familiarity with the area and the people. Now, for the negative influence of spectators, it could lead to a lot of pressure, right? There could be a negative effect on performance due to the pressure because some performers may choke when crowds are hostile or when expectations are high. There's also potential for crowd trouble slash hooliganism, which is basically when there is violence, disorder, and intimidation and just antisocial behavior from spectators. It can come with safety concerns because more security might be needed, and so the cost of hiring more security personnel rise. And lastly, there's a negative effect on participation numbers among young members if the sport starts to feel unsafe or toxic because young people and their parents might start wanting to avoid the sport. Now let's look at why does hooliganism occur in the first place. These are the main reasons why hooliganism occur that AQA want you to know. Now let's look at strategies to combat hooliganism. So AQA want you to know these strategies and be able to evaluate their effectiveness. So we have early kickoffs, which reduce the likelihood of having alcohol-fueled behavior. We have the provision of all-seater stadiums, which obviously provides the chance to have more control and less crowd movement. There could also be segregation of fans, which reduces clashes between opposing fans. Also having improved security measures such as CCTV, searches, and stewarding. Also imposing alcohol restrictions. Also having travel restrictions and banning orders for spectators that display antisocial behavior. And lastly, promoting positive behavior through education or promotional campaigns and endorsements. Now let's talk about exam technique. So if you were to get 6 markers on this topic, you want to use this structure to get full marks every time. And the structure goes like this. You want to start with your point and then explain and then give examples. So sporting example. To evaluate, you can also give a counterpoint and finish up with a judgment. And if you want to practice this structure by answering some real questions on this topic, then check out our platform www.superpeonline.com for a ton of resources to help you get the best grades in this course. Super PE Online is the best PE platform in the world, so you are guaranteed to have high level resources that will help you take your grades to the next level. See you in the next video.